Dr. Jonathan Cunha brings multifaceted contributions to cardiothoracic surgery and medical education. Dr. Jonathan Cunha is a trailblazer in cardiothoracic surgery, widely respected for his clinical expertise, leadership, and dedication to advancing medical education. As chair of cardiothoracic surgery at Mayo Clinic Arizona and professor of surgery at the Mayo Clinic College of Medicine, he has established himself as a surgeon-scientist with a profound impact on patient care, research, and training the next generation of healthcare professionals. His journey exemplifies the integration of cutting-edge clinical practice with innovative research and a steadfast commitment to education, educational foundation, and breakthrough research. Dr. Cunha's academic journey began at the Medical College of Wisconsin, where he earned both his MD and PhD in microbiology and immunology. During this time, he achieved a groundbreaking discovery, identifying ISG-15, a novel interferon-induced immunomodulatory cytokine. This pivotal research explored the cytokine's potential in activating the innate immune system, offering promising implications for immunotherapy and oncology. His postdoctoral work at the University of Maryland and the National Institutes of Health, NIH, further refined his expertise in immunology, solidifying his reputation as a surgeon-scientist. This foundation set the stage for his integration of science into clinical practice, where he has consistently applied innovative approaches to improve patient outcomes. From the outset of his career, Dr. Cunha demonstrated a commitment to merging research with clinical applications, a dual focus that remains central to his contributions in medicine. Surgical training and early career leadership. Dr. Cunha completed his general surgery residency and cardiothoracic surgical fellowship at the University of Minnesota, where he cultivated a profound interest in thoracic oncology and cardiothoracic transplantation. He quickly rose through the ranks to join the faculty as a thoracic surgeon, specializing in lung failure and transplantation. At the University of Minnesota, Dr. Cunha's passion for medical education became evident. He developed a groundbreaking course designed to help medical students transition to residency, equipping them with practical skills and confidence. This course was later adopted by the American College of Surgeons, becoming a national model for student preparation. His efforts earned him prestigious accolades, including the University of Minnesota Outstanding Medical School Educator Award and the Association for Surgical Education's Surgical Educator of the Year in 2011. Transformational impact on thoracic surgery. After his tenure at the University of Minnesota, Dr. Cunha was recruited to the University of Pittsburgh, where he expanded his contributions to thoracic surgery. He served as surgical director of lung transplantation, chief of the Division of Lung Transplantation and Lung Failure, and vice chair of research for the Department of Cardiothoracic Surgery. During this time, he became one of the first surgeons in the United States to utilize ex vivo lung perfusion, EVLP, in clinical practice. This revolutionary technique enhances the viability of donor lungs before transplantation, significantly increasing the number of organs available for patients in need. He was also one of the first to advocate for intraoperative AV ECMO during lung transplantation. His leadership also extended to minimally invasive and robotic thoracic surgery, with a particular focus on lung and esophageal oncology. Dr. Cunha's tenure at the University of Pittsburgh highlighted his ability to lead complex programs while advancing surgical innovation. His efforts in ECMO, extracorporeal membrane oxygenation, and lung failure management further established him as a leader in handling the most challenging cases. Leadership at Mayo Clinic Arizona. As chair of cardiothoracic surgery at Mayo Clinic Arizona, Dr. Jonathan Cunha continues to push the boundaries of what is possible in his field. He leads an exceptional team while spearheading initiatives such as the DCD heart transplant program and the EVLP initiative. These programs are not only advancing patient care, but also shaping the future of organ transplantation. Dr. Cunha's leadership philosophy is rooted in servant leadership, resilience, and a focus on team collaboration. He emphasizes the importance of mentorship, goal setting, and creating a supportive environment where team members are empowered to innovate. By aligning his team's efforts with a shared vision, he fosters a culture of excellence and high performance. Mentorship and educational legacy. Throughout his career, Dr. Cunha has demonstrated an unwavering commitment to mentoring the next generation of surgeons. He has guided hundreds of undergraduates, medical students, residents, fellows, and faculty, many of whom have gone on to become leaders in their respective fields. His approach to mentorship includes building meaningful relationships, encouraging self-reflection, and fostering a disciplined practice of goal setting. Dr. Cunha's contributions to education extend beyond one-on-one mentorship. His curriculum development efforts, including the medical student transition course and numerous surgical training programs, have had a lasting impact on medical education nationwide. Research and global influence. A prolific researcher, Dr. Cunha has authored and published hundreds of manuscripts, abstracts, and book chapters. His work spans a wide range of topics from thoracic oncology to transplantation science and has earned him international recognition. His research into thoracic oncology focuses on minimally invasive treatments for lung and esophageal cancers, while his work in transplantation continues to advance the understanding of lung preservation and immunology. In addition to his research, Dr. Cunha actively participates in professional societies and committees, contributing his expertise to improve surgical standards and practices globally. His involvement underscores his dedication to advancing the field not only within his institution, but also on a national and international scale. Approach to patient-centered care. Dr. Cunha's patient-first philosophy is central to his practice. He believes in personalized treatment plans tailored to each individual's unique needs, ensuring that patients receive the highest level of care. Whether performing complex lung transplants or minimally invasive cancer surgeries, he prioritizes clear communication and compassion, fostering trust and confidence among his patients. Leadership insights and vision. Dr. Cunha attributes his success to a combination of mentorship, disciplined goal setting, and a commitment to lifelong learning. He frequently engages in self-reflection to evaluate his progress and refine his approach to leadership. This mindset has allowed him to remain adaptable and effective in managing both clinical and administrative responsibilities. Effective decision-making, according to Dr. Cunha, requires a balance of evidence-based practice, collaboration, and strategic foresight. He approaches challenges with grace under pressure, ensuring that decisions align with both immediate needs and long-term goals. A legacy of excellence. As Dr. Jonathan Cunha continues to lead the Cardiothoracic Surgery department at Mayo Clinic Arizona, his influence is felt far beyond the walls of the clinic. His contributions to lung transplantation, thoracic oncology, and medical education are shaping the future of healthcare. By integrating clinical excellence with groundbreaking research, he exemplifies the best of what it means to be a surgeon-scientist. His dedication to patient care, mentorship, and innovation ensures that his legacy will continue to inspire and guide future generations in the field of cardiothoracic surgery.